Welcome to Muskegon Rising, a community service project of the Muskegon Rotary Club. Our purpose is to create lasting positive change. We've been doing that here since 1916. So, let's get started.
Hello, friends. DJ Hilson here, yet for another episode of Muskegon Rising, where we get to talk about not only leaders in our community, but the positive direction that they are playing a role in the organizations that they represent. And today, I have the distinct honor, privilege, and pleasure of interviewing Gary Allore, President, CEO of Trinity Health. I had to make sure that I got all that right because we'll talk about some of the changes that have gone on with the health system. But first of all, thank you for doing this, Gary.
Oh, it's a pleasure to be here, especially with you, DJ. I'm looking forward to this.
Well, good. I promise, as I promise all my guests, that I will not put you under my lawyer cross-examination mode. This will be a casual conversation.
All right, good. I feel better.
That's right. Well, let's start with your history.
Sure.
With the health system, where you began, and sort of the timeline and where you are today.
Oh, absolutely. So, I've got a long history in Muskegon. I've been here my whole life, so definitely have a personal history in Muskegon and love this community. But from a healthcare perspective, so I've been in healthcare since 1988. So what would that be? 36 years-ish. Yeah. So been in healthcare a long time. Worked in public accounting for a few years out of college. I graduated from Albion College. With a business degree. So been in healthcare since 1988, and I started at Muskegon General as their controller, their director of finance in 88. I worked there for 8 years at Muskegon General, which is now part of the consolidated Trinity Muskegon. Worked there for 8 years, and then I actually moved and worked as the CFO at Gerber Hospital in Fremont. So still living in Muskegon, made the commute, but worked there for 9 years. And then back to Muskegon as the CFO for then Mercy Hospital in Muskegon. Been there since 2005. So from 2005 until now, had a variety of different roles. But I started as the CFO for Mercy. A lot of name changes,
yes,
but
right.
Trinity's kind of the name going forward. But the CFO for Mercy Hospital in Muskegon. And I did that, so I started in 2005, and as everyone knows, the consolidation between Mercy and Hackley happened in 2008. So Hackley came on board in 2008, so was the CFO of that organization, that combined new organization for about 4 years. And then after that, for the next 4 years, I was actually the regional, work with Roger Spulman, who was the regional CEO in West Michigan. I was the CFO for Muskegon and for Grand Rapids, because St. Mary's at that point is still part of Mercy Health. So I was the regional CFO. And then when Greg Loomis retired in 2017, I ended up getting the position as the president for Muskegon in 2017. So I've been in this job now for almost 7 years. So that's kind of my history, but mostly in West Michigan, all in West Michigan, and mostly in Muskegon.
So, this question literally just popped in my head. But so you graduate from college with a business background, and you get into healthcare. What was the draw to healthcare? I mean, you've created a career out of it. Yeah. So what drew you to that?
Actually, when I worked for Seidman in Muskegon, one of the audits I worked on was at the hospital at Muskegon General, and I knew after a few years in public accounting that that wasn't the career I wanted to be in. I definitely wanted to work in an organization where you could kind of have a personal impact on the organization and the community. I had worked on the audit a few years at Muskegon General, and Walt Dabrowski, who was the CFO at Muskegon General way back then, and I had some conversations and interviewed there and ended up moving into healthcare. I knew I wanted to do something different, and then I got in healthcare in '88 and just loved it. I mean, there's not a better environment to work in than a healthcare setting. People that kind of move to healthcare as a career are just kind people who want to take care of their community. That's just the kind of people that work in healthcare. Yeah, they want to take care of people, and it just makes for a nice environment to work in. Love the people I work with, and there's no more worthwhile career than you could have is in healthcare. I mean, I think just taking care of our community every day is so important to a successful community. So it just loved it, loved the people I work with, and just never wanted to leave.
Well, that's fantastic. It's interesting, and I've only been a part of this community since 1999, and the transformation of the healthcare system in Muskegon has been an interesting one, mm-hmm. and you've basically lived that entire transformation. Can you talk a little bit about what the advantages have been with all the, we won't talk about the name changes, but the consolidation and what that has meant to the Muskegon community? Well,
I hats off to our community, our providers in the community, and some of the former administrative folks that worked in healthcare in the community. I think going back to when Muskegon General and Mercy came together, and that was in 1998. So when those two organizations came together in our community, that was kind of the first of some of the consolidation or coming together of our healthcare community. But I think some of my predecessors really realized that in a community the size of the Muskegon community, then 160,000, now we probably have 175,000 in our community, that it would be very difficult to have three competing health systems in a small community when so you're duplicating administrative costs, you're duplicating because of competition, a lot of clinical equipment, and three smaller organizations, it's harder to get some of the efficiencies and be able to invest in the community when you're busy competing and kind of spending and having more administrative costs as well. So that happened in 1998. And then Mercy General, which was the combination of that organization in Hackley, made the decision to try to come together in 2008. Well, it happened in about 2006 is when the conversation started. It ultimately came together in 2008, and that was huge for our community. One, those two organizations, Mercy started with the Sisters of Mercy in 1903. Charles Hackley made a significant donation to start Hackley Hospital in 1904. So those two organizations were competing in the community for 100 years. So those two organizations coming together to become Mercy Health was a huge thing, and it was just in advance of the Great Recession that happened in 2008. And I can tell you that both those organizations would have struggled to survive if we didn't come together at that time. So that was just providential that actually happened then. And then the recession hit us. But from a community perspective, our ability to invest in the facilities and the people and the things we needed to do would have been very difficult to do with three smaller hospitals. Now we have one pretty significant organization that has become kind of a tertiary referral center up to Ludington, down to Holland. It's a nice, I think it's just an unbelievable asset for our community from a people perspective and a facility perspective.
Yeah, I mean, it's been sort of fun to watch that transformation take place and all the positive things that have fallen from that. What I've learned in some of my I'll say community work with Trinity is the expansive Trinity network, because it goes beyond the state borders of Michigan. Yep. Can you just talk a little bit about that and the advantages that folks here in Muskegon have because of the sort of far-reaching arm, if you will, of the Trinity Health system?
Yes, I think you consistently hear mixed things about the Trinity name in the community, but I think it's a community asset that people just don't really understand. So Trinity Health, obviously a faith-based organization, one of the largest systems in the country, I think the second largest Catholic system in the country, but some of the huge benefits are that being part of a system, you just see with a lot of the cyber stuff going on, the ability to have some of the IT infrastructure that we have to kind of ward off some of that kind of activity that's happening all the time is one huge thing. But I would say, the scale of Trinity, we're able to use that scale and scope in learning from across the country. I think having an organization that is located in many different states in the country, from a healthcare perspective, some at different points in time, some states might be more favorable to healthcare than others. So to balance that across the country, we get the benefit of there might be other states that are doing better in a certain way than Michigan, or Michigan might be doing, but having that big system to rely on is super helpful. what's really nice, just in Michigan, there are 5 other people in similar positions to me. We meet every week, and we're just talking about some of the dynamics going on in our communities, learning from each other, just learning a lot of different strategies and ideas that have worked in other communities in Michigan and across the country. You just wouldn't have that in a smaller local hospital. So I think some of those resources, and then one, gigantic resource that certainly has been positive for Muskegon. I can tell you that the $320 million investment we made in our medical center when we came together, when we brought the medical centers together, that investment, along with the ambulatory investment we just made in North Muskegon a few years back and Norton Shores a few years back, those are things that would have been a lot harder to do with a smaller standalone hospital. The asset of Trinity, just the bond rating that they have, the ability to access funds at a lot lower rate because of the scale and the success. We're a AA rated organization, so that benefit certainly has helped the Muskegon community too. And so I would say there's just a lot of networking that happens for all of our leaders. They can, like I said, they can get on the phone and talk to other leaders in Trinity when we're dealing with something or sharing some of our best practices that are happening in Muskegon. So it's a nice asset for this community, and we still do though have the community feel, and I think the autonomy. A lot of strategies come from Trinity as we're looking across the country at things we're trying to do, but how we operationalize it, we try to put a Muskegon touch on the way we try to do things in Muskegon because we know our community better than Trinity. Trinity realizes that. So there's a lot of wins with being part of a big system, and you just really don't see a lot of standalone small hospitals anymore. And we are so pleased to now be integrating Grand Haven, formerly North Ottawa, into our system. So that's been really fun the last 18 months or so.
Yeah, it certainly does open, for a person who's looking for, providers and other things. It does open the door for all those great possibilities. So that is a huge benefit. Since you kind of touched on community, I'm gonna pivot here just a little bit, and let's talk a little bit about Trinity's community involvement, because I think a lot of people don't recognize necessarily. I mean, they may see Trinity, downtown on the hockey arena, but they don't understand the other outreach efforts and the community benefit that Trinity Health does provide. So can you touch on a few of those things, please?
Yeah, I sure can. I think that's sometimes people don't realize that we are a nonprofit. And part of being a nonprofit is our ability to provide benefit to the community. Part of being a nonprofit is we're not paying property taxes. And so with that, we actually do a lot for our community. So, and we appreciate DJ's on our advisory board for the Muskegon Community Health Project, is a division of Trinity Muskegon, and that's really the community benefit arm of the organization. So we're right in the middle of it right now. We're kind of completing we do a community health needs assessment every 3 years. We partner with a variety of local nonprofit organizations to try to look at what are the needs, what are the top 5 to 10 needs in our community for the next 3 years, and try to focus on those. So Trinity Muskegon through the Health Project leads that effort. But there's a lot of partnerships with the police, with Pioneer Resources, United Way, just Access Health, the FQHCs, together do a variety of interviews across the community to say, what are our biggest needs? And then we kind of lead the effort to provide structures that impact those needs over the next 3 years. So as we look at the needs in the community, we kind of put together coalitions across the community that are working on, things like, I know Ride for Pride is one of the big coalitions that I know you've been involved with, and Sheriff Poulin. And so we kind of lead that effort and fund a lot of that effort as well. So we provide I think one of the things that is part of our community benefit structure, we provide a lot of direct resources. One of the things that we're so proud of that we provide for the community is we have probably 20 to 25 community health workers that are out in our community every day helping our community deal with trying to get insurance or trying to get Medicaid or working in people's homes to make sure that they're staying on their meds. We provide a lot of free pharmaceuticals, but making sure our community is staying on their meds so they're not having to be in the ER all the time because they're just, having health situations. So our community health workers is a big part of what we do with our community health project. So it's an important part of what we do. We're really engaged in the community. I think because of the health project name, sometimes that's not always connected to Trinity, but it's part of the great work that we're doing every day. So we're proud of that.
Yeah, well, you should be, and I would encourage folks that are listening to this podcast to really dig deep into that, because people need to, I think, appreciate and recognize how invested the Trinity Health System is in the community in a lot of different ways, and having playing a small role in that and seeing it on a regular basis, I have a great appreciation for that, and obviously thank you and leadership and certainly your board for allowing that arm to not only exist but grow and expand. It's really important.
Just a great example of it is a couple great examples of some of the community benefit. One was as the McLaughlin Groves Community Farm is kind of transitioning right now. We absolutely knew that they've used the space on the Legacy Hackley property for that farm, and we knew there was a need to keep that going. And so we're actually bringing that into the health project and into Trinity just to keep that because we know food insecurity is such a huge thing in our community. So that's one big thing that we've just recently made the decision to move that forward and bring it in. And the other thing that I think a lot of people know, but we're super proud of when we did transition and come together between Mercy and Hackley. We donated the legacy property that the Hackley Hospital is on, and that hospital is basically sitting where the football field is now in the new middle school. So we're excited about that. That legacy of Charles Hackley will live on in that same location that it has since 1904. So we're really proud to be able to do that, and that's just something that our community needed, and it's a great consolidation project for the middle schools of the community. So those are just a couple examples of community benefit that's important to us.
Absolutely. So let's talk a little bit about some of the, as science and technology continues to advance, and it's just amazing to me, and I don't even know the half of it, probably the quarter of it, but where's the innovation for Trinity now? Where are you guys at as far as whether it's surgical procedures or medical practices? What can people expect that live in this community?
Well, I think because of now the scale of Trinity, but the scale even of Muskegon now as we've come together, we're really a couple of our specialty service lines. We continue to invest because there's a need in this community. Two big ones. One, our signature service line for Muskegon has been cardiovascular since the 80s, since Dr. Demo started our open heart program at Mercy in the 80s. That's been an important service line. And when there's a new technology happening in the CV space, we're pretty much doing it in Muskegon. So just in the last 5 years, we're doing there's a lot less invasive procedure now. Instead of open hearts, we're doing a lot of TAVRs, which is a non-invasive outcome that gets you kind of a similar outcome to an open heart procedure. But we're doing EP in Muskegon, we're doing Watchman, we're doing cardio memes, and just a lot of new technology that's happening in that space. We continue to invest in, and we're doing in our community. Get a lot of referrals from along the lakeshore for that service line. One of the things that we're working closely with, you've probably seen some ads about the cardiovascular network of West Michigan, which is basically a joint venture between Trinity Health Grand Rapids, Trinity Health Muskegon, and U of M Health West, which used to be called Metro over in Grand Rapids. Metro just opened a new open heart program in the Grand Rapids market. So the three of our facilities are just trying to work together, coordinate care, and just have more scale to continue to invest in cardiovascular services. Certainly, of the three programs, the Muskegon program is the biggest because we've been here the longest and we've been doing open heart since the 80s. But we continue to invest in Muskegon and try to grow that network and really stay connected to the Frankel Heart Institute in Ann Arbor. Is one of the best known in the country. So we've got connection there, and we've never had consistently 3 open heart surgeons in Muskegon. We have that right now. So we've got Dr. Downey, Dr. Bilesma, and Dr. Boovy all doing open heart cases. Generally speaking, in Muskegon, we've usually had 2, sometimes even 1 open heart surgeon. We have 3 right now, and just doing a great job for this community. Our medical staff is unbelievable. On a little less clinical side, one of the things as recruitment continues to be a concern across the country, especially in the RN space, we actually just started our virtual nursing program in January. So we actually now are on 2 of our nursing floors. We're providing a virtual nurse model that our state board was just here this week, and they got to go visit that, just talk to the virtual nurse. And so we've got a model now where we have a virtual nurse that's kind of looking over a floor virtually, and then we've got a care team of a nurse and an LPN or a nurse and an aide that are taking care of a bigger group of patients with a virtual nurse watching every patient day to day, which is just trying to use the resources that we have and use technology. And it's amazing how the response from the families of patients that know there's a virtual nurse there that can always be watching the patient. The family really likes it. The virtual nurse can kind of give updates all the time to the family, obviously to the patient, and it's a super secure situation where the virtual nurse has to knock on the camera and the patient has to say, yes, you can come in. And it's really cool. It's been working really well, and it's only been 3 months now, but we're definitely starting to see some positive outcomes from a patient experience, from a falls, from a length of stay perspective, because there's just that extra set of eyes all the time on the patients on a given floor, night and day. So that's been a cool technology.
Hey, I tell you, it's just amazing to me how these advances are making it, certainly from a patient standpoint, making it a lot easier to talk to somebody, even if it's not face-to-face, you're talking to somebody. And as you mentioned, the resource aspect of it, the being able to put people in those spots. So I want to pivot there for a second, if I could, because it sounds like, as is true in the legal field, it's the same in the healthcare field, where it's been hard to find people to fill critical spots. And so, can you talk a little bit about Trinity's efforts in recruitment and retention, and then I'm going to ask you some questions about the overall employment possibilities.
Okay. So recruitment is definitely been, especially in a couple pockets. For us, it's been in some of the surgical specialties. RNs obviously continue to be a shortage across the country. It probably will be for the foreseeable future. And we've had some pockets in respiratory too, where we've struggled to hire. And what's interesting is when I talk about this, mostly from an RN perspective, we're in a really good place on the day shift. It's night nursing is harder to recruit in the industry, and it has been harder in Muskegon. And the interesting thing is because during and after the pandemic, there are roughly 15% of healthcare workers got out of healthcare, decided to do something different. It was a tough time during the pandemic, so that happened. But then you've got there's so many different possibilities for nursing. So I would recommend a nursing career to anyone. You'll have a job for life. There's no question that every community is hiring nurses, but there's so many different things they can do, both patient bedside, but there's more case management, there's management, there's a lot of different things, there's utilization review. So nurses can do a lot of different things, and that's partially causing some of the shortage. So generally speaking, a nurse used to come out of nursing school and work on night shift for 2 or 3 years, kind of get some experience and get some seniority, and then move to the day shift when day shift positions have opened. Well, now you've got nurses coming out of nursing school that are actually, they can choose where they want to work and the shift they want to work. So there's just not as many nurses that want to work nights when they can work days, and they can work in a specialty quite a bit quicker than they used to because there's just such a need in ER and ICU and certainly med surg. But so that's caused some of the recruitment challenges on the night shift. So, but we continue we're just looking at different models, like I talked about with virtual nursing. But from a recruitment perspective, we continue to work with our local community college in Baker. A lot of nursing programs, a lot of tech kind of programs, and we're very connected to those two organizations to recruit. We've got one of the big things that has been really positive for us is we've had an extern program so students that are in college are working as externs in our hospital. So they're getting nursing experience. They'll even take the LPN boards while they're in nursing school, and we're able to advance their pay to an LPN pay. And then when they come on as a nurse, after they graduate, they've already got a lot of training, so they don't need as much training when they're going to actually start taking care of patients by themselves. But that program, last year, I think we had about 80 externs working with us. And at the end of the school year, whenever they were finishing school, I think we had like a 70 to 80% retention rate. So once we had them in there, they actually stayed in our organization. So that's been one thing that's really helped us. But it's interesting that we're in a unique situation where we're not a real large community, but we've got a very large health system. So we're the second largest system in Michigan of the Trinity sites, and we happen to be in a smaller community. So recruiting is just more difficult. We have 700 nurses that work at the hospital, and when you've got Lake Michigan to the west, you can't recruit fish. So a lot of these metropolitan areas have a bigger circle to recruit from. We've got two great colleges that we recruit from. Grand Valley, we get a lot of students from, but it's just harder to recruit to this community. From a retention perspective, that this is we're super proud that our most recent turnover information, our turnover rate for Muskegon is about 11%. So in a lot of businesses, that doesn't sound great. We used to be, back before the pandemic, we'd be usually running around a 9% turnover. If you look at Trinity across the country, the turnover is about 18%, and healthcare is about 18 to 20%, just because there's so many opportunities for people. So the turnover in Muskegon, we're the lowest of the Trinity sites in Michigan, and so we take pride in the fact that once we can get them here, they as you and I both know, they love this community. Yeah. They're like, oh my gosh, I cannot believe this community. We just don't do enough to celebrate what a great community we do. And I think we're doing way more of it. But so once we get them here, we're generally able to keep them. So we're proud of that, but we're just always recruiting. We've got for our colleagues, we've got a lot of referral bonuses that we provide. So a lot of nurses know nurses. And so we offer incentives to say, if you can get a friend to work here, we've got incentives to do that. A lot of tuition reimbursement. The pay and benefits of our colleagues is super competitive. So we do a really good job at making sure we're staying market competitive. And generally speaking, the cost of living is a little better in Muskegon. So you can make a competitive wage with probably a little lower cost of living. And we are definitely seeing that as the community keeps growing. I think people are starting to see that this is quite a place to live.
Well, I can't agree. I can't agree with you more on that for sure. Last I had heard, I think it's still true, Trinity is the largest employer in Muskegon County. Is that an accurate statement?
Yeah. Yes, that is a very accurate statement. So, not only being a big community benefit arm of the community, we have about 4,000 colleagues that work here. So we've got 4,000. I think the next largest employer is maybe around 2. So by quite a bit, we're the largest employer in the community. And we take that super seriously because, so healthcare jobs are generally good jobs for our community also. And so the community needs a strong healthcare system. To have a strong school, strong healthcare, you're going to be able to recruit businesses to this community. So as the largest employer, we take that serious because we know that a big part of the economic development that happens in Muskegon, the healthcare system has to be strong. When the downtown area and the lakeshore area, I remember 3 or 4 years back when we were building our new facility, that was a $300 million project. And at that same time, there was about $1.2 billion or $1.3 billion of investment going on in Muskegon. So we know we're trying to grow with the community and trying to lead some of that growth also as we can. So we try to stay super involved in the chamber and the foundation, and we try to make sure that we're super connected to this community because we know that we're the largest employer, and we know our community needs a successful health system.
So along those lines, for people that are listening to this and maybe don't appreciate and understand the entire infrastructure of what goes into the healthcare system. I mean, I think everybody thinks nurses, doctors, administrators, but we don't employ 4,000 nurses, doctors, and administrators. And so could you maybe talk a little bit about what the employment opportunities are, in particular, even for those that may not have a 4-year, maybe they have a 2-year degree?
Boy, you teed that up perfectly,
I did,
DJ.
yes.
So interesting you said that, because I just mentioned we have 700 nurses.
Yeah.
We probably have employed physicians, maybe 400. So that's 1,100. And we have 4,000 colleagues. So you make a great point. And that was one of the recruiting things I forgot to mention when we were talking about recruiting. Our chief of staff, Dr. Jerry Evans, has been working hard on this initiative called High School to Healthcare. So we're really trying to make sure that our schools know the different kinds of health careers that you can have in this community, because we know because it's difficult to recruit, we need to grow our own, we need to recruit our own. So back in February, we had 135 kids from the Career Tech Center that came into our hospital. And we had about 8 different stations where the kids could go spend 6 to 8 minutes at each station. So it would be a station with, you kind of started from the beginning to the end of healthcare. So you had a station where our ambulance company was there, EMTs. They were there kind of talking about what that profession looks like. Then you have ER there talking about what a tech position would be, what a nurse position would be, respiratory therapy. Then we had a section with our lab and our surgery and our environmental services, our maintenance crew, our food and nutrition services. So there are so many in our lab. Just in the lab, there's lab techs and there's med techs, but then there's also lab assistants, phlebotomists, and we have so many careers. So between like our food services department and our environmental services department, we probably have 400 people that work in those 2 departments. And when people, as I told you about me, as people get in and work in the healthcare system, people love working there because it's just a friendly environment. And so we have so many people that'll come into lab as a phlebotomist or come into our environmental services department and, turning beds and doing that work and say, man, I think I want to work here for my career. And we'll either go to a tech program or just kind of advance within the organization because they want to stay in the organization. That's where a lot of our nurses come from. That's a lot of where our lab techs and our imaging techs come from. We have a lot of people that'll stay in those departments for their career as well. Our minimum pay at Trinity with really good benefits, the minimum you're going to start at is $15 an hour, and it goes up from there, obviously. But we have good positions with good benefits as well. But there's so many different careers that we're trying to make sure our high school kids know that they don't have to have a 4-year degree or even a 2-year degree to get many different positions in our organization. And there's a lot of them open at any given time as well.
Now, if I remember correctly, because I had attended an event in which sort of a high school event where Trinity was involved, is there also the opportunity if you want to advance, like let's say, I don't really want to do community right away, or I don't want to go to a 4-year right away. I'm going to just kind of start working. And then I want to advance. Is there an ability, or does Trinity offer tuition assistance or reimbursement as a result of that?
Yes, absolutely. That's exactly what happens in the organization. Someone will come in and say, I'm not going to go to college. I'm going to get a job. And then after a period of time, things change and they're like, okay, I think I'm going to try. I've been around this department enough to know I think this is something I'd like to do. We do have tuition reimbursement to help support going to the community college or a 4-year college. So, that's how a lot of advancement. I was just talking to our leader over the housekeeping department just yesterday, and he was just talking about how many people he sees in the organization that he's been the leader of 20 years ago that are working somewhere else in the organization because they kind of left and went to a different role. And he says that we like being the breeding ground for other departments. That's what we do. So
That's awesome. Well, I want to finish. You mentioned it a couple of times, so I want to finish this interview with you explaining and talking about that $300 million investment, that the change that has made for our local healthcare system, not only from certainly from a healthcare perspective, but also from a patient experience perspective. Talk a little bit about that beautiful building that we can see off the highway on Sherman.
Yeah. I think as Hackley and Mercy came together in 2008, the ultimate vision was always, we came together organizationally in 2008, but our vision was always to come together in one facility where we can all be working together. And the legacy of Hackley and the legacy of Mercy kind of come together in one organization. But there's no question that it's a state-of-the-art facility that'll be with us the next 30 years. I mean, those are investments that last a long time. A funny note, our Hackley and our Mercy campuses were two of the oldest campuses in all of Trinity before we came together. Now we have a new facility. But to have the benefit of private rooms, beautiful rooms where a family member can stay with their loved one the whole stay. We have nice waiting rooms, but we're finding in a lot of our floors, there's such a nice space in the room that patients are staying there. There's a roll-out bed in all the rooms where a family member could sleep in the room with their loved one if they chose to do that. But the facilities are beautiful, but the people in the facilities we moved in right in the middle of the pandemic. So now we're finally on the other side of the pandemic now for a year and a half or two. We're finally starting to use the facility like it was meant to be used for. So we're really just kind of starting to understand the facility, understand everything that we have from a flow perspective. But I think the facilities for our community are amazing. They're going to be with us a long time. We're fortunate we made the investments when we did, because things are getting really tight in healthcare these days because of recruiting and all those things. So the investment we made was really good timing.
Excellent. Well, listen, Gary, I've known you for a few years, and I just appreciate where you are today in the Trinity Health System, your continued commitment not only to healthcare here in Muskegon, but to the community. I think it speaks volumes, not in what you've talked about, but certainly the actions that Trinity has taken over the last several years in both those categories. So thank you for helping keep Muskegon healthy, but also being an important investment in the community members outside of the healthcare system. I think that is a very proactive and preventative way. So thank you for all those things and being the leader of that.
I'm so honored to be able to serve in this capacity in the community that I grew up in and that I love. And when it comes to initiatives going on across Trinity, I always have Muskegon's back. And we're as we look at things, our mission as an organization is to be a compassionate, healing presence for our community. And in my mind, when I think about community, I have my entire family lives here, all the nieces and nephews and parents. And so the word community means a lot to me because it's my family, basically. And so I'm just so proud of the work we do and love working here.
Fantastic. Well, again, thank you for joining me today and being a part of this Muskegon Rising podcast. And ladies and gentlemen, that concludes this interview. I want to thank certainly Muskegon Rotary for its continued commitment to the projects like this. And none of this happens without the vision, the mission, and the wherewithal of Mike Vogus. Thank you, Mike.